I, Dr. Rajesh Kumar Sharma, Professor and Head Department of Critical Care Nursing and Coordinator Skill and Simulation Center of Swami Rama Himalaya University. We are here to discuss today about the basic lab support among the children. So, in the previous module we are discussing about the adult, but in this module we are discussing about the children, how we can initiate this basic lab support. So, it may be difficult to imagine a child being a victim of the cardiac arrest, but it certainly happens. Pediatric cardiac arrest is not as common as adult cardiac arrest. In adults, the cause of cardiac arrest is often cardiac related, but in the children and infant, cardiac arrest is often due to respiratory problem such as airway obstruction, drowning, opioid overdose or seizures. So, there are chain of survivals in children also. So, pediatric chain or survival has 6 links: in hospital chain of survival or out hospital chain of survival. So, you can see in this pic that in hospital and out hospital. Early recognition prevention is the change over here, and in the out hospital the prevention is the first priority. So, this is the major change over here, and we will discuss once again that both pediatric chains includes prevention of cardiac arrest, activation of the emergency response system, high quality CPR, advanced resuscitation, post cardiac arrest care and recovery. In hospital setting, the difference is the first link. It focuses on early recognition and prevention of cardiac arrest, which emphasizes patient monitoring and assessment. Differences between children and BLS for adult: anyone from age 1 year old to puberty is considered a child. Puberty is defined as chest or underarms hair on boys and any breast development on girls. Compression on a child, use 1 or 2 hands. So, we can, while giving compression in children, we can utilize both the hands or either one hand also sometime or 2 hands also. So, when you are performing a compression on a child, use 1 or 2 hands, whichever works for you for compression and allows you to provide deep effective compression. To effective, your compression must go to a depth of the child chest, that is approximately 2 inches or 5 centimeter, and the chest must recoil completely between compressions. For a single rescuer, always, whether the victim is a child or an adult, a single rescuer always uses a compression to ventilation ratio is 30 compression to 2 breaths. For 2 rescuer team, however, if you have a rescuer team and the victim is child, the ratio changes and should be 15 compression to 2 breaths. So, we have to see that while giving the chest compressions, the chest depth should be at least 1/3 of the total diameter, or it can be a 5 centimeter or maybe a 2 inch also. The rate of chest compression is 100 to 120 compressions per minute we have to maintain. So, here is the major change is that only when the person are two rescuers are there, in that case we have to change the ratio, that is 15 to 2. Other than rest, everything is same as into the adult. Or if you feel that if you can give chest compression with one hand, that also you can do, or otherwise you can utilize both the hands, you can go for that also. So, let us see in the video how we have to go for a basic lab support in a children. For basic lab support for a child, we have to first go for the response. So, if there is no response, we have to go for assessment. We have to assess the carotid, pulse and as well respiration. We should not consume more than 10 seconds for the assessment. And before the team comes, we have to initiate the chest compressions. If there is no response, we can utilize we can use both hands for giving chest compressions, or sometimes we can use single hand also. And after 30 compressions, if single rescuer, then we have to go for 2 rescue breath, and after giving 2 rescue breath we should not consume more than 10 seconds, and again we have to resume CPR, chest compressions. Again we have to go for 2 rescue breath, and after that we can see that how with one hand also we can give chest compressions, one hand chest compressions, one rescue, one hand rescue also.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29.
So this is the techniques, one hand and both hand we can give. Rescue breath, now 2 breath. Okay. So you have seen in the video that how we have done the basic lab support for a children. So I hope that you have understood the basic lab support among the children, and thank you for watching our module. Namaskar.